Are you concerned that you have scoliosis? Or have you been diagnosed with scoliosis and are looking for natural remedies? Or are you concerned you need surgery for your scoliosis? Then this video is for you. I'm Dr. Karin Drummond, owner of Drummond Chiropractic, and I'm going to be sharing with you the different types of scoliosis, how we diagnose scoliosis, and the different treatments for scoliosis. And as always, before you follow any advice from any video, check with your healthcare provider to make sure it's appropriate for your specific condition, and hopefully that's one of us here at Drummond Chiropractic. If you like our video, please let us know by clicking the like button. And as always, if you have any questions or concerns or suggestions, please post them below because we would love to hear from you.
The different kinds of scoliosis are thoracic scoliosis, which is where the curve is located in the middle of the back, thoracolumbar scoliosis, where the curve is between the middle and the lower parts of the back, lumbar scoliosis, where the curve is located in the lower lumbar spine, and you can have a double curve where one curve is one way in the middle back and the curve is the other way in the lower back.
So how we diagnose scoliosis at Drummond Chiropractic is we simply have you bend over and we look at you from the back. And we have an instrument that measures the amount of degree of curvature that you would express if you have scoliosis. If you don't have any scoliosis, we can visually see that you don't. But if you do, we'll measure it with this device. That way, every time you come in, we can verify that your scoliosis is maintaining or improving with treatment. If it's progressing, we'll refer you out for an x-ray because it's imperative that we make sure that our treatments are working for you, because if it's progressing, then it is not. And how we'll treat it is we could do chiropractic manipulation, exercises to strengthen the muscles that are stretched and weak, and we'll give you stretches to stretch out the muscles that are tight and constricting and rotating your spine aberrantly. We can refer you to physical therapists and personal trainers if you need the help at home to do your home exercises. We can also support you nutritionally with supplements if needed. And although chiropractic, physical therapy, home stretches and exercises are not a cure for scoliosis, they can improve the quality of life of the person because it's not a straight spine that's a healthy spine. It is a functional and pain-free spine that is one. So if you're keeping the function alive and you're able to do your activities of living without any pain, that is our goal. And also stopping the progression of the curve. Now, if your progression continues, we may add bracing. These are special braces that help limit the progression of the curve. Now, the issue with bracing is some studies say they work and some say they don't. And my belief is if the bracing is done properly and done well, it can work. So how do you make bracing work? In my experience, if you wear a brace all day to stop the curve, let's say you have a curve this way, and then you have a brace that forces that down. If you wear that all day long, what is your body gonna do? It's gonna fight that brace and make the muscles that are already strong, stronger, and the ones that are weak, weaker, because the brace is doing the job that the muscles should be doing. And there are some studies that suggest that just wearing the brace at night is more effective than wearing them all day long, because when you're sleeping, you're relaxing, the brace is holding you in a neutral position, and when you're awake, you're using the muscles you need to do. If you exercise the ones that are really weak to raise that shoulder up and stretch the ones that are tight that are causing the curve, that will help the progression of the curve from stopping or even reversing. But if you wear that brace all day, it may have the opposite effect of what you're looking for. And this is why it's imperative to have a healthcare provider that will figure out exactly what you need. Bracing, not bracing, just bracing at night. It really is dependent on the person. So what about surgery for scoliosis? The problem I see with surgery is, yes, your spine will be forced into a straighter position, but at the expense of function. So your spine will be straighter but less mobile, and this can affect the quality of your life. And the other problem with surgery is that because there's certain segments of your spine that can't move, the segments above and below have to compensate for this lack of movement, and this can strain those regions, leading to pain in those regions. So if you can treat your scoliosis without surgery, if there isn't an impact to your lungs and your heart and your organs, and it's just an aberrant hump that you're dealing with, my biased opinion is to keep the function alive and move pain-free versus getting a straighter looking spine at the expense of the quality of the movement of your body. But again, This is really dependent on your specific needs. So before you get any surgery, please talk to a chiropractor, your family doctor, a surgeon, a physical therapist. Talk to people who've had the surgery, opted not to have the surgery, so you can make an informed choice, because once you have the surgery, there is no going back. And I've had too many patients that regretted that decision, but I've also had patients that were happy with that decision. It just depends on the severity of the scoliosis and the amount of function you had before and after the surgery. And again, if you have any questions about this, please post them below. I hope this has been helpful, and until next time, stay well.